the last paper is the use of stochastic resonance methods for improving laparoscopic surgery performance. Jinling Wang from Wright State and his group will present.
Thank you. Hello, everyone. My name is Jinling Wang. I will be talking about using stochastic resonance methods for improving laparoscopic surgery performance. We have nothing to disclose. Haptics refers to the sense of touch. It can provide different types of information, such as temperature, texture, pressure, and vibration. It is greatly reduced in laparoscopic surgery. One way to provide valuable haptic information during laparoscopic surgery is to use vibro-tactile feedback. It's one type of sensor substitution through the haptic channel. It has been shown to improve the performance during different tasks. Besides vibro-tactile feedback, stochastic resonance has also shown performance to improve human performance. Stochastic resonance, or SR, is a phenomenon where the signal can be boosted by adding white noise to increase signal-to-noise ratio. When SR is applied to the human subjects at subsensor level, although the subject cannot feel it, it has been shown to improve the sensitivity and performance in manual tracking and sensor motor tasks. In this study, our research objective is to see if SR can improve the performance in a laparoscopic palpation task and to compare SR with the vibro-tactile feedback. We hypothesized that both SR and vibro-tactile feedback would have better performance over no feedback, and SR would have better performance than vibro-tactile alone. A laparoscopic trainer box was used in our task. The subjects used the probe to detect the presence of simulated tumor embedded in the tissue sample. Two haptic actuators were used. The one attached on the upper arm provided vibro-tactile feedback, and the one attached on the forearm provided SR feedback. For all the 16 subjects, the baseline were measured without any haptic feedback. After that, they were randomly assigned to one of the four conditions: the control condition, the vibro-tactile condition, the SR condition, and the condition with both vibro-tactile feedback and SR. For each condition, there are 36 trials, and 2/3 of them had embedded tumor. They were randomly presented to the subjects. The time to detection and the accuracy of tumor detection were measured. The changes above the baseline were calculated. The figure on this slide shows the results for accuracy. On the x-axis, we have 4 different conditions, and on the y-axis, it shows the increase in accuracy above the baseline. The NOVA results show that there was a significant main effect, and the post-hoc test showed that SR was significantly better than control condition, and it's also significantly better than vibro-tactile condition. The figure on the right-hand side shows the results of the time to task completion. There was no significant main effect. This suggests that the higher accuracy in SR condition was not achieved by sacrificing time to task completion. There was no speed accuracy trade-off, and SR had better performance in terms of accuracy. In summary, SR feedback had higher accuracy over the control condition and vibro-tactile condition. The results have the implications for the design of instrument and potential methods for increasing accuracy in minimally invasive surgery. This technology could also help surgeons better identify tumors located in health surrounding tissue. Thank you for your attention. I would like to take your questions.
All right, the floor is open for questions. A very interesting problem that all of us deal with. I had a question about, a lot of the feedback is dependent upon how much pressure you will put on whatever object you are trying to identify and get some sensation, because we kind of use some of our own experience from the open surgery, but with the instrument, how much pressure do you have to apply in order to get potential feedback, to be able to feel exactly what that tumor is or is not, or if it's even there?
So for the two type of feedback used in this study, for the Weber tactile one, the frequency and the amplitude is related to the interaction force between the tip of instrument and the tissue sample. And for the SR feedback, its type of vibration is now related to the interaction force you're applying on the tissue sample. So it's kind of adding a very large range of white noise. So it has different range of frequency, and it can boost the frequency with the one similar to the vibration you got from the interaction. And for the noise, it's not going to be boosted so that it can improve the sensitivity of the subjects.
Any other questions? Why do you think that the SR factor was more important than the bibliotactic?
This research is kind of like exploring. So from the results, we found that SR had better performance. And we expect that for different tasks, it may be different. We don't know. We need to have further study on this. But for the task we used in this study, the SR had better performance. And another reason, possible reason, could be for the Weber tactile feedback, after a while, the subjects kind of more likely to have the adaptation to that, so that the improvement will now be as well as good as the SR.
Okay. Good. Any other thoughts, comments, questions? Well, thank you for that interesting presentation, and I appreciate all that.
Thank you so much.
You know, the thing that I'm very interested in is a lot of these papers very much are at the beginning of some very interesting data. And I think that as we explore some of these issues, because tactile issues and all the haptic issues are really big problems that we're going to need to address. And the development and changing of tissue within the human or with the experimental animal initially. But these are really interesting things, and I hope that, and I just encourage all the investigators this morning that when you go back to your labs, you just continue to increase and help us with this knowledge, because this is really exciting and new stuff out there that we're going to be seeing great developments over the next few years. But thank you all, and we've been able to end a little bit early. And so we can all go down and have a little more breakfast. That would be all good, or another cup of coffee, whatever. But I want to thank all of the presenters and their teams this morning. They've done a great job, and very interesting data. Thank you again for everybody.